Team members reminded me there's a lot of folks out there with a lot of times on their hands right now, especially with their loved ones, and in a few months we might start seeing some babies out there. So I have a couple things I'd like to talk about when it comes to pregnant ladies, newborns, and babies in dentistry. So we have a saying here in the office, and that is, if you find that you have become pregnant, well, first of all, congratulations, God bless you, and what a wonderful gift is about to happen. But also, ladies, you may notice there's some changes in your body there. Now, a lot of these wives' tales will say that the moment you have a baby, well, by golly, you get a bunch of cavities because the baby takes calcium from your teeth. Well, that's just a wives' tale. That's not really true. What we have found, though, is ladies tend to be a little bit more likely to get cavities during pregnancy, well, because of a couple things. First of all, you might find that you're eating more often, not necessarily more. And that's really where cavities come from. Every time you put something in your mouth that has, well, sugar in it or carbohydrate, that allows the bacteria to form an acid which can cause cavities. So every time you put something in your mouth, there's about a half an hour of time that goes by until your body can buffer the acid down back to a neutral level, and that tends to not allow the cavities to happen. If you just ate 3 meals a day, you probably wouldn't get much in the way of cavities. But from what I've been told and what I've noticed, well, when ladies become pregnant, they tend to eat a little bit more often. So we have a saying to help you fight cavities. Many of our ladies go through multiple pregnancies here in the office, both team members as well as patients, and not get a single cavity. Well, that saying's real simple. If you're eating for 2, you need you to be brushing for 3. That means I need you to be brushing 1 more time a day. Most folks do real well brushing in the morning before they're off to work and right before they go to bed, because that's when cavities occur the most. But if you can add 1 more time a day brushing, well, a 3rd time, that significantly decreases the chances you of having any cavities. Now, we love folks with babies. We are a family-oriented office, and we can't wait to see your baby. Typically, we start out with a happy visit. Now, for patients of record, a happy visit, there's absolutely no charge for patients of record. You bring that beautiful child in between the age 2.5 years of age. They come in and they sit in the dental chair, and I wave at them, and the ladies kind of giggle, and they get a prize. It's all about leaving happy. Then, when they're about 2.5 to 3, those beautiful children get to come in for a more traditional first dental visit. Now, that first dental visit is when we go in and we polish the teeth and count the teeth, and, well, they get a prize. It's all about leaving happy. What we have found is, with that happy visit, there's no expectations from myself or the parent. Hey, that kiddo is just going to come in and get a prize. We have found that's a great way to welcome young people, especially babies and infants, into our dental office here. Now, the moment that you find your family has been blessed and you are pregnant, we have a wonderful tradition. We love to give a baby bag. It's a gift from us to the office. It usually includes a cute little stuffed animal and a whole bunch of important information and products to help you keep your child's teeth and gums healthy. Everyone says, when should we start brushing that kiddo's teeth? Well, I'm going to recommend about 3 months of age. Once the baby can hold their head up and they're kind of not the bobblehead that they are when they're real small, about 3 months of age, it's good to get in there with a special little finger toothbrush that we put in our baby bag for you and gently clean the tongue and the gums and the floor of the mouth. Everyone says, why? There's no teeth in there usually yet. Well, I'll tell you, it sure is a great behavior to get into when the child is 3 months old and they kind of get used to you getting in there and getting everything clean versus waiting until they're a year old. They can go, no, and push you away. And it's a little bit more difficult to get the child used to it. Plus, what we have found is the cleaner you can keep the baby's mouth, the child's mouth, during the teething process, well, the less poopy diapers you have and runny noses and less crying, and the kiddo seems to be doing better and happier. And less crying for mom and dad makes you better and happier. So here at our office, we love to remind our kiddos that there's 3 great rules, important rules that I like for them to follow to have a great dental visit. And they go like this. I'm going to have you, when you come see me, hold still like a statue. keep our hands down by our belly, and open big like an alligator. And when you do those 3 rules, well, it's fun to go to the dentist. Now, mom and dad, if you can start putting those rules in the kiddo's head for us at an early age, boy, it makes life easier for you. Why? Because when you're brushing your little one's teeth, and just remind them, Dr. Lordo's 3 rules: hold still like a statue, hands to our belly, and open big like an alligator. It'll make your brushing teeth experience with your children, well, a lot easier and safer. You won't get hit in the head and poked in the eye with a toothbrush and stuff like that. So here at Dr. Lordo's office, we are very excited and enthusiastic to see the baby boom that may happen in a few months. And we are ready and excited to meet your new children.